As we get older, gravity can be very hard on our face.
Present company accepted, of course. If you're tired of seeing drooping skin when you look in the mirror, a new 1-hour lift might help. Health Watch reporter Beth Galvin joins us now with her special report. Beth?
Russ and Amanda, this procedure uses surgical threads to lift up your face, and it works kind of like Velcro underneath your skin. One single mom from Atlanta decided to find out if this 1-hour lift could give her a younger look. At 49, Catherine Phelps loves being a mom to first grader Maurice. And after losing 60 pounds, Catherine's worried a drooping jawline is making her look older than she is.
I have a 7-year-old, and I didn't want to look like the grandmother at the PTA meetings. I wanted to look like Mom.
Catherine, who's getting ready to launch Beautiful, a new magazine about looking better, is hoping these surgical sutures can pull up
at least an inch of lift.
What gravity has pulled down.
And to have 2 little pokes and then have your face pulled up from the bottom, to me it's just incredible.
A few days later, Catherine arrives at Byrd Medical and Anti-Aging Center in Roswell for a feather lift.
I like the fact that you can do it within an hour, hour and a half. Perfect right there. Don't move.
Catherine's before pictures are taken.
Exit point here.
And then Dr. Marcia Byrd sketches out exactly where she'll place the Proline sutures in the lower part of Catherine's face.
But we can't stop aging, but we can slow it down.
Catherine is awake during her feather lift, but her face is numbed and medication is helping her relax. Dr. Byrd uses a hollow needle-like instrument called a cannula to thread 4 plastic sutures under the surface of Catherine's cheeks.
As we age, the fat in the cheek area seems to go south.
The ends are tied off and will tighten over time, lifting the tissue.
And you can take the sutures and just lift it up.
Catherine can feel pressure,
but I didn't feel any pain whatsoever.
At first glance, these sutures look like a piece of blue plastic string. But if you look closer, you'll see they have barbs, just like this, that move in different directions. And those barbs attach to the skin, pulling it tight and giving the face a lift.
It's not going to pull up a face that's really saggy. But if you're starting to sag or have just a few areas that need to be enhanced, it's a wonderful procedure.
But the feather lift can cause complications. The barbs can be jarred loose, the results can look uneven, and in rare cases, patients can actually feel the suture under their skin. If any of those things happens, Dr. Byrd says the threads can be replaced.
If I see that something's not just right, I can go back and tweak it slightly till we get it just exactly perfect.
In less than an hour, Catherine's done.
Oh my gosh.
Isn't that great?
Oh my gosh.
I know.
Keep the adhesive tape on a couple of days, and then I want to see you back in 3 to 4 days, okay?
What did you think when you first looked at it?
I was amazed. My face was real droopy, and now it's like it used to be 20 years ago.
It looks beautiful.
Catherine will have to take it easy for a couple of days, and she'll have some bruising.
Within 2 weeks, it's going to look totally normal. And over several weeks, maybe 3 to 4 months, it's going to continue to tighten.
2 weeks later,
I have more of a lift around this area, and I have more of a lift of this part of my face.
Here's Catherine before and after her feather lift. Dr. Byrd says the $1,800 lift should last about 5 years, about the same time as a facelift.
So you're pleased?
100%. 100%.
And with the launch of Catherine's magazine just days away,
it's just a little boost I needed to hit the ground running.
Catherine did experience some swelling after her procedure, but she says she hasn't had any problems that require tweaking. She's hoping to have another feather lift pretty soon to lift up her forehead and eyes. And as for the pain factor, she says she didn't feel much pain at all, but then again, she says she has a really high threshold for pain.
Looked like it might have hurt. It also looked like it worked. Now, is this as dramatic as a facelift or not?
It's not. You could basically think of this as sort of a mini facelift, but Dr. Byrd says a lot of people don't need the full facelift yet. This buys them a little time.
Very good. Beth, thanks.